Hi guys, welcome to your library at home. It's me, Elda. And if you guys noticed, I have a visitor here tonight. I have Dr. Poulos here with me, one of our local family doctors. And we are going to not be doing crafts. We are going to be doing questions and answers about COVID and the vaccine. So feel free to comment in any questions that you might have, and we will do our best to answer them all. Okay, Dori, they're all yours.
Great. So Elda's sitting 6 feet away so I can take off my mask. Thanks for having me. And I was told that this was a bilingual event. So I will be, just like Dr. Ezeki, who I admire very much, I'm going to do things in first English and then Spanish. And I was already asked a few questions. One is the general overview about what does a vaccine do. A vaccine, and I apologize if this is too basic for some people, but it might be, some other people might really need this information. A vaccine is using a piece of a virus to trigger our own body's immune response to fight it in the future. Now, the traditional vaccines that we were used to in the past either used an actual virus that had been attenuated, which means made very much weaker so that it could not really get you sick. The chickenpox vaccine is like that, and the measles vaccine. Other vaccines take a piece of the virus and attach it to something else and put it in your body, and your body recognizes that little piece and will attack the virus. Some vaccines last for quite a long time. As you probably know, your tetanus shot lasts for about 10 years. Others need to be redone every year, like the flu shot, because the flu has many different forms and it changes every year. The two COVID vaccines that we have right now in the United States, the Pfizer and the Moderna, are different. They work by using a piece of messenger RNA that gets into our bodies and actually makes the spike protein, the thing that sticks out of the coronavirus, the reason why it's called corona, and that protein then triggers our body's immune response so we can fight the actual infection. So that's kind of an overview of vaccines, and I'm going to say the same thing in Spanish. I apologize. Spanish is my third language, so I apologize in advance if I make grammatical errors. Para una introducción quiero explicarles cómo funciona una vacuna. Disculpe que si esta explicación es un poco demasiado fácil o básico, pero tal vez que les va a ayudar. En general, las vacunas usan su propio cuerpo para batallar a la infección usando su sistema de anticuerpos. Las vacunas tradicionales usaron o un virus o bacteria que se han hecho más débil para no provocar la infección, solamente para provocar la reacción de su cuerpo. Las dos nuevas vacunas que tenemos en este minuto en los Estados Unidos son de la compañía Pfizer y la otra compañía Moderna. Funcionan de una manera muy moderna y muy diferente que tal vez es lo que vamos a hacer en el futuro por muchas más infecciones. Usan un pequeño pedazo del RNA del virus para entrar en nuestro cuerpo, fabricar un parte del proteína del COVID, y nuestro cuerpo después va a reconocerlo y batallarlo usando los corpúsculos blancos y los inmunoglóbulos de nuestro cuerpo. And so that's the first question, which was already presented to me by staff, which was, how does a virus work? Have any question come in yet, or should I go on to the next one?
No questions have come in, but I do have a question for you.
Mm-hmm.
When you are vaccinated,
Mm-hmm.
do you need to wear a mask?
Yes. It is not certain, and the thing about this virus in general is that there's things that we just plain don't know, and we're learning because it's new, and that's why information changes. As of right now, it seems that the vaccine will prevent at a very high level, after the boosters, after the second shot, you have about a 94% protection, which is excellent. But it is not certain that that actually prevents you from carrying some virus particles in your nose. It just means it won't create actual disease and invade your body. Therefore, it is strongly recommended, urged, that no one gets out of the habit of wearing these until we know more. La pregunta fue si después de vacunarse, si se debe de usar la máscara. En este minuto les voy a decir lo que sabemos, porque la ciencia siempre está progresando y tal vez en el futuro vamos a tener otra recomendación, pero en este minuto recomiendan que se debe de seguir usando la máscara porque es posible que todavía las personas que tienen la vacuna no se pueden enfermar, pero todavía tienen partículas del virus en su nariz que pueden infectar a otra gente hablando o estornudando. Okay?
All right, let's see, we do have a question. How long will a COVID vaccine be effective? Months or years?
That's another question that we don't know yet. Because, think about it, it hasn't been out long enough for them to really monitor. I'm certain that what the companies are doing is that they are checking blood levels of the antibodies in the people that have received the vaccine. I'm also certain that they're doing observational studies, 100 people with the vaccine, what percentage might get the illness eventually after what time frame. So that's the only ethical way to do it, is observational. No one's going to take people and blow coronavirus in their face to see if they're going to get sick. That's just not ethical. So right now we don't know. Worst case scenario is that you're going to need a booster at some point. If it ends up being like the flu shot, we may need boosters for this every year. We'll find out. We just don't know. La pregunta fue si vamos a necesitar refuerzos en el futuro de estas dos vacunas. El hecho es que en este minuto no sabemos. Yo estoy cierta que las dos compañías están haciendo muchas investigaciones para observar a eso, probablemente chequeando la sangre de la gente para ver qué es el nivel de los anticuerpos. Pero por lo pronto no puedo decirle. Mi opinión es tal vez vamos a necesitar refuerzos, tal vez cada año, vamos a ver.
Okay, let's see. I read there's a new strain and that we should wear a surgical mask underneath a cloth mask for better protection.
Mm-hmm. That's been something, well, first of all, a lot of people have been wearing a cloth mask over a surgical mask, or in the hospital, to make our N95s last longer, we wear a surgical mask over the N95 for extra protection. We've been doing that for a long time. Because the United Kingdom strain, and now it seems like the South Africa strain, are more infective, even though this hasn't, I'm not aware that this has come out as a firm recommendation from CDC, but quite a few experts are talking about, for extra protection, wear 2 masks, especially if you're wearing cloth masks, to wear 2 cloth masks, and they should be a tight weave. Don't knit or crochet masks. Use something like the kind of, I'm sure Elda, who's a crafter, knows, the kind of cotton that you would use for quilting, that kind of very tight weave cotton, if you're into making your masks, and I know many very talented people have been, and a double layer is always better, especially with the cloth masks. La pregunta fue si es necesario usar 2 máscaras a la vez. El CDC no lo ha dicho eso por algo firme, pero tal vez con los nuevos tipos del virus que son más infectivos, no sería mala idea, especialmente si están usando máscaras de material para darse más protección, y de tratar de usar, de construirlas, descoserlas de un tipo de algodón que es similar a lo que se usan que son más fuertes y más densos.
Okay, we have a question in Spanish and I can't read it. Can
Well,
you?
You gotta have an
go to
eyeball.
your next
You're
one.
gonna have
Do
an
you have a next
eyeball
one
right
there?
at the thing. Let's see. Permítame. Let's see.
You don't want to do that. You can
¿Cuánto
read from your
son
screen.
personas no entiendo la pregunta. ¿Cuándo van a vacunar personas de 3 edades en Elgin? No entiendo esto. ¿De cuáles edades? lo que puedo, the question was, what are people of 3 ages going to be vaccinated and eligible? I'm not sure I understand it. I'm gonna answer the question that I think it is, and if I'm wrong, I apologize. At the moment, Kane County, and much of Elgin is Kane, and I just attended a meeting about this, so I have a very fresh update about where we are in Kane, is finishing up with the boosters for Group 1A, which is nursing homes and healthcare workers, and soon, within 2 weeks, we'll start with Group 1B. So, la respuesta es por el condado de Kane, y disculpe que si no entendí bien su pregunta, disculpe. ¿Cuándo vamos a vacunar a personas en general en Elgin? El condado de Kane, que es el condado que la mayoría de Elgin está localizada, está terminando ya en esta semana o 2 semanas lo más de poner la segunda vacuna, la refuerza a las personas que trabajan en los hospitales, en las clínicas, las personas medicales y a los residentes de las casas de ancianos, que son un grupo de los más delicados y sensibles al virus. Después vamos a empezar con el grupo 1B, personas de más que 65 años de edad y grupos de trabajadores esenciales.
Okay, was that just the question, when will there be vaccines available for seniors in Elgin?
Yes.
Okay, so let's see.
And I have to add something else. Todo eso depende en los condados en que vive la persona. Por ejemplo, si ustedes viven y todo se puede buscar en el sistema del web. Lo más fácil es de hacer un Google por su condado. Por ejemplo, Kane County Health Department o Cook County Health Department. Póngalo eso en Google para irse a la página del web y para saber más información. I was just saying that this is somewhat dependent on counties because the vaccine is being distributed per county. So if you are on this program but you happen to live not in Kane but in Cook or McHenry, Google your county's health department. I have Googled them all. The first page is about coronavirus and it has a button to click for more information. Follow the links. Most of them allow you to sign up to receive information and alerts. That will not guarantee you an appointment or a slot for the vaccine, but it's a first step to being informed and to getting information when your turn comes up.
Okay, we have one in English.
Good.
How can I get this? Oh, it's CP vaccine?
The who?
I think it's a CP, but I can't read it. But you may have another one on here, and let's see if it comes in clear.
Let me see. Well, let's go on to the next question. And we'll try to figure out the CP vaccine. Or do you mean the COVID vaccine? Well, that's kind of what we've been talking about. To figure out, stand back a little bit. To figure out when you'll qualify for the corona vaccine, if you go to IDPH website, you'll get an idea of the definitions of group 1A, 1B, 1C. There's these categories were set by the CDC, but there has been some tweaking by the different states. For example, the state of Illinois decided to start with age 65, not to start with age 75 because of the relatively younger number of younger people that have gotten the virus in Illinois. En general, para saber cuándo es su turno, recomiendo que se va a la página del CDC o del condado para ver en qué grupo estás aplicable. Tiene que ver con dónde trabaja la persona, su edad y sus otros problemas medicales o sus riesgos.
Okay, I have one for you.
Yeah.
Unless you have another one. Mm-hmm. Let me pull it up. Mm-hmm. Oh, see, I don't understand what that is. Can you tell us about social here? Are we losing general immunity? Oh, this one is from Jean Bednar. Are we losing general immunity from never being exposed to any other germs for all this time while we protect ourselves from COVID? Isn't that what the vaccine?
No, I truly don't think so. First of all, there's an amazing number of germs that we're exposed to. We're lucky in that this has been one of the mildest years for influenza that I've ever seen, because wearing the mask prevents us from, we've been basically avoiding some respiratory viruses. You're still prone, unfortunately, to the gastrointestinal viruses. The world around us is covered in microbes. I think our immune system is just fine. So that's a good question. I think there's more danger to the overuse of cleaning products for absolutely everything, which is another story. But la pregunta en español fue si estamos haciendo daño a nuestro sistema de anticuerpos, evitando tanto al contacto con microbios. Y mi respuesta es que esta máscara nos protege de varios microbios respiratorios, pero hay muchos más microbios que vienen del piel, del sistema intestinal, de la boca, de comida. Entonces no creo que estamos haciendo daño a nuestro cuerpo evitando al virus con la máscara.
Okay, here's one for you. Is the vaccine safe for pregnant women?
This is an interesting question. For an individual pregnant woman, you have to discuss it with your own physician. I'm going to give you some general information. There were no studies done on pregnant women. There were no pregnant women in the groups that were studied for the vaccine. Now, actually, there were a few pregnant women, because there were a few women that started the trial and then found out they were pregnant. And from what I understand, that there were no ill effects. This was obviously very early pregnancy. But since these groups were not studied, I think it has to be a person-by-person decision along with your personal physician, your family doctor, or your obstetrician gynecologist as to whether your particular situation puts you at enough risk. For example, I think a pregnant healthcare worker, my opinion is that should take the vaccine, okay? Because pregnant women are more susceptible. A pregnant woman who is working from home and doesn't really go anywhere much, it's a different calculus. You have to decide personally. So la pregunta fue si es una señora en estado debe de tomarse la vacuna. No tengo una respuesta cierta porque no han hecho investigación en este grupo de pacientes. Por casualidad fueron uno o dos, un pequeño número de señoras que salieron encintas mientras que estaban en el grupo de estudiar la vacuna, y de lo que yo sepa no han tenido ningún efecto negativo. Pero en general, porque no tenemos datos, hay que decidir cada persona pensando en su propia situación, su propio riesgo y con su médico. Por ejemplo, una señora encinta que está trabajando en un hospital tiene más riesgo que otra persona que trabaja en su casa con su computer. Hay que tener pendiente también que la vacuna parece que es más fuerte y pega más recia a las señoras encintas. Entonces disculpe que es una decisión un poco difícil que tiene que decidir cada persona.
Okay, I have a couple more for you. Is there anyone who should not take the vaccine?
At the moment, no. I think that the only consideration is that there's been this concern about serious allergic reactions, and I think a practical thing, because I've had, first of all, eggs. Eggs are not a problem. For a long time, it's been like flu shots for the egg allergy, you can take it. This is not made in eggs. Egg allergy is not a problem. But in general, if someone has an allergic condition severe enough where they need to have an EpiPen in their pocket or their purse, take it with you to the vaccine. No one's going to make people get the vaccine. But I think that a lot of professionals, if someone is a healthcare worker or a worker in a meat packing plant, I think there's far more risk for COVID than from the fact that they have a bee sting allergy, which doesn't seem to have any interaction at all. But there is that concern. Take your EpiPen with you. You're observed for 15 minutes after the shot. There's obviously medical personnel there giving you the shot. So I'm not aware of any absolute contraindication to the vaccine. So, la pregunta fue si hay algunas personas que nunca se deben de tomar esta vacuna, que yo sepa no. Hemos tenido la preocupación que personas que tienen alergias muy graves o muy fuertes, por ejemplo, de las abejas, que usan la pluma que se llama EpiPen para inyectarse, que lo llevan consigo cuando se van por la vacuna, aunque probablemente que no tiene nada que ver, pero por un poquito más seguridad. Y también se pone la vacuna, se va a sentar y estar en observación por 15 minutos. Y la gente que está aquí es gente médica que le puede dar apoyo si fuera necesario.
Okay, here's an interesting one. Dr. Poulos, this is twofold. How can I get my 102-year-old mother the vaccine and she is your patient? So this is a fun one for you, Dr. Poulos.
Pues, okay, because of the cold chain required for this vaccine and the numbers involved, at the moment there's really, I don't know of any smaller private practice like ours that has the vaccine. The way for an elderly person that is not homebound, the best thing to do is to get online and sign up at one of these websites, and because it's going to be available, I think, within 2 weeks at a variety of settings. Kane County Health Department has done some very efficient vaccine fairs at the Kane County Fairground. It's going to be available at some of the bigger national chain pharmacies, probably, from what I understand, some of the bigger clinics like Oak Street or VNA or Greater Elgin that have a much higher volume than a small private practice. The other question that is being seriously looked at and hasn't been answered yet is the homebound elderly have a problem, because if an elderly person who has had a stroke and is homebound, that I think that's getting worked at the health department even as we speak, perhaps using some type of a home visiting nurse type situation. But that piece hasn't been worked out. I think someone that has a homebound senior needs to work with their individual physician, maybe contact the health department and see what's getting worked out. So the question en español es que están preguntando para una persona que está muy avanzada de edad, como 102 años, ¿qué pueden hacer? En general, que yo sepa, las oficinas particulares o más pequeñas como la mía no pueden tener la vacuna porque no tenemos la refrigeración correcta para mantenerlas. Pero después de como 1 o 2 más semanas, especialmente en este condado de Kane, lo van a tener en varios lugares como el Fairground, que está por la calle Randall en St. Charles, varias farmacias grandes, las clínicas que son más grandes, y va a ser gratis. Claro que probablemente una persona de esta edad no tiene computer ni sabe cómo funcionarla. Las personas más jóvenes en su familia tienen que ayudarse de irse a la página del web y registrarse y seguir siendo bien informados.
Okay, this one has been asked several times. I feel like this is a tough one. Will there be a time when we can go back to social gatherings, sports, concerts, etc. without masks?
I don't know. Yeah, probably, but not right away. I think that some people love sports. I love live music. I would not mind going to the Elgin Symphony like this. It wouldn't kill me. I'd still be listening to live music. You know, some people love live sports. Will there be a time? I think so, but not right away. We got to really get a handle on this. The numbers got to come way down. You know, there was a time, most people my age or older have a thing on their arm that's round, and it's the smallpox vaccine. And we don't give that vaccine anymore, and we don't worry about smallpox anymore because it's been eradicated. You know, no one has to worry about being scarred for life or dying. So I think there will be a time, but I don't think it's going to be this year. What I'm praying for is that by fall we can go to sports and concerts and stuff, and if we have to maybe sit every other chair, or if we have to wear this, that's a small cost to pay.
Okay, I have two good ones
and I didn't
for
say
you.
that in Spanish. ¿Cuándo pienso yo que podemos dejar la máscara para siempre? No sé. Yo tengo fe en el progreso de la ciencia. Por ejemplo, el ejemplo de la enfermedad variola, que ya no existe en el mundo porque se vence por las vacunas. Pero por lo pronto, a lo menos yo creo por este otoño, yo creo que si podemos regresar a deportes, a conciertos de música y a todas las cosas que nos gusten, que tal vez va a ser necesario seguir con la máscara. Vamos a ver.
Okay, there's two here. I don't know which one to go first, but we'll start with this one. The new variant is 70% more contagious. How so? Like, does this mean the masks and hand washing are less effective? I really don't understand what that means. I'm going to add to that question, and if we are vaccinated, is it covering both of the strains of COVID?
Okay, the second question is easier. So far, the mutation in the new variant seems not to, the vaccine and the immune response, so far, everyone is feeling good that it's effective, okay, including Dr. Fauci. How is it more effective? I apologize, I'm not sure I know the basic science answer. What I assume it is that probably it's more effective at going from the phase of attaching to your nose versus entering into your respiratory system and the rest of your body. But the basic science answer to why, I don't know.
Okay.
And maybe someone does, but I don't. La pregunta es por qué el nuevo tipo de la vacuna de Inglaterra, si va a funcionar la vacuna. Hasta este momento parece que sí. Todos los expertos en que yo tengo mucha confianza, por ejemplo el Dr. Fauci, dicen que sí, que va a ser efectivo. ¿Por qué es más invasivo? Esa es una pregunta tal vez por una persona que hace más investigaciones que yo, no sé, pero así dicen.
Okay, I have got to back up a little bit here. Okay, if we've already got the virus, should we still get the vaccine if we still have antibodies?
That's another question. The current thinking, even though there's a little bit of controversy around the exact timing, is that if you have the illness, that 3 months later, you should be vaccinated, because that's pretty much the time frame at which your protective antibodies are gone. There have been multiple cases of people with second infections, which really stinks, and sometimes it's harder to go through it the second time. So the only thing that I've heard a little bit of discussion lately is some people saying, should it be less than 90 days for the vaccine? But most everyone is saying 90 days after you are appropriate to be vaccinated. So, después de sufrir de la infección, la opinión más corriente es que después de 90 días se debe de vacunar para protegerse, porque sí se puede pegar otra vez el virus de coronavirus. Apenas oí que hay otros expertos que piensan tal vez menos que 3 meses, pero de esto, en este momento, la mayoría de personas dicen 3 meses.
Okay, how do we sign up for alerts? How do I make it so I know when I'm available for the vaccine?
Well, sure. First of all, know what county you live in. Go to the website of that county. It'll be on the first page, because this is what everyone cares about. And I know that at King County's website, which I've practically memorized, it's in English and Spanish. You click there, it takes you to another page. You fill in really simple things: your name, your zip code, your email. And then it asks you a few questions that helps the website stratify you into where you fit. And then you will get email alerts. When you get the email alerts, some of them will just be informational. Oh, we're not up to you yet. But when it gets to you, the email alert will have a button that you can click to make appointments with the health department. Hopefully, as more pharmacies come on board, it'll also have information on, well, if you don't want to come to the King County Fairground, you can call this Walgreens or this, I'm sure that the pharmacies have their own alerts. And have their own systems. I don't think it does much good to call your local pharmacy today, other than driving them crazy, because everyone asks them and they don't have it yet. Yeah? So para estar informada, váyase a la página del web de su propio condado, registra para los emails en que le van a avisar cuando está listo. En la mayoría de los condados tienen varias preguntas sobre su edad, sus riesgos, sus enfermedades, para poder decirle en qué grupo está.
Okay, so this is kind of a twofold question because somebody asked this, but I'm gonna ask the second one because it kind of goes hand in hand, I feel. And I'm gonna pronounce this wrong, I know it. I am a caregiver for a 10-month-old baby with mastocytosis, and I am 63 years old. Where can I get the vaccine? But here's the second question, so I don't know if you can tie these in together. IDHS just came out with a statewide guidance to vaccinate caregivers of specific health conditions, cerebral palsy, Down.
Yeah.
Any idea when King County will open up? So they kind of go together a little
King
bit.
County, this just came out. It was discussed today at the King County Health Department Advisory Committee meeting. They're well aware of it. All these caregivers are in groups where they share information and so forth. I think they're going to end up getting put, I'm not sure if they're going to get put into Group 1A, which means they can go now, or Group 1B. But I know that that's something that just came off the presses. And I think, once again, the place to go is a combination of the county website, but also whatever support group that person is in, and they're going to be super on top of it. But this is just a very new thing, because that's one type of care. Because think about it, if you work in a nursing home and take care of people that are vulnerable versus working in a home and taking people that are vulnerable, you're still a caregiver. So it makes perfect sense. It's just that this is very new. This is what I know. La pregunta fue si estás trabajando con una persona que tiene que está débil, que tiene algún problema grave medical, pero que no está trabajando en una casa de ancianos o hospital, pero en su casa, tal vez es su propio padre o madre. Hay apenas hoy o ayer incluyeron a esas personas en los grupos para vacunarse más pronto. En este minuto no puedo decirles más información, tal vez en la página del condado. No sé exactamente si van a estar, por ejemplo, en grupo 1B o 1A, pero eso es algo que sí están. Ya saben que ustedes necesitan la vacuna también más pronto.
Okay, what is the difference between Pfizer vaccine and the Moderna vaccine?
They're very close. They're both RNA vaccines. They're both very effective. They have the same platform. The Pfizer is just a little bit harder to work with in terms of, not for the patient, for us, because it requires extremely cold temperatures, whereas the Moderna not so much so. They both require boosters, Pfizer at 3 weeks, Moderna at 4 weeks, so there's more similarities than differences. I don't think there's any reason to nitpick. You take the one that's available when it's your turn. Don't overthink this, get one of them. ¿Qué es la diferencia entre las dos vacunas Pfizer y Moderna? Son casi iguales del tipo de vacuna. Las dos necesitan refuerzos, uno en 3 semanas, otro en 4. El Pfizer es un poco más difícil por los doctores y los médicos porque necesita refrigeración tan fuerte, pero en general son casi iguales y las dos son muy recomendables. No hay que escoger una u otra.
Okay, how fast does a vaccine take to become effective to provide against COVID, and will we have to get it reoccurring every couple of years?
The reoccurring I already answered, we don't know.
Right.
I bet you we will, but we don't know. The become effective, my understanding, and this is, I personally had the Pfizer vaccine, is that after the first shot, you're about maybe 50% protected. And then after the booster, 2 weeks after the booster, you're, quote, fully protected, which means about 94%.
Okay.
So, para sentirse protegida después de las vacunas, la más fuerza sería después de la segunda vacuna y como 2 semanas después.
So basically, once we get vaccinated, we still kind of have to act as if we are not, because we have to protect the people around us. And
well, there's still that 6% chance risk for yourself. There's always the chance that, God forbid, there's going to be a mutation that is not going to be covered. And also just to be polite to others, because if we still don't know if our nostrils and our mucous membranes are contagious, why would you want to go breathing on people? So después de vacunarse todavía hay que usar la máscara por lo pronto.
currently, right now, what status is Kane County at? Did we just move to 1B? So have we vaccinated all of the healthcare workers?
We're finishing up 1A. There's still a sizable group of 1A healthcare workers in nursing homes that are at the booster stage. For example, there's going to be a bunch of healthcare workers getting the booster, not this Thursday, Friday, next Thursday, Friday. So and a lot of the nursing homes are getting their boosters this week.
Okay, and then we move to 1B,
Yeah.
which is...
Essential workers and people over 65.
Okay, here's a real good one. Does it hurt to get the vaccine?
Almost nothing. It's a pinch, it's a shot, but it hurts less than the flu shot, I thought. And so no. La pregunta fue si duele la vacuna. Un poquitito, casi nada. No hay que preocuparse de eso.
Okay, and do you think that, I know other okay, here's a good one. This has not been asked by people, but it has come up. Can you get the vaccine in a county other than your own?
In Illinois, the way I understand it, you have to either work or live in the county where you're getting the vaccine. So, la respuesta es que si se puede vacunar en un condado que no es su propio condado, hay que tener un comprobante que enseña que vive o trabaja en el condado en que se va a vacunar.
Okay, I believe this one was in Spanish. What reactions are we seeing after the second dose?
There's a variety of reactions that are mild. For some patients, it's just the same old sore arm. Some people are getting low-grade temperatures or feeling a little achy, little muscle soreness. I've heard one or two people say they felt flushed or maybe a little nauseous. Nothing that terrible and fairly brief, maybe a half a day. I think it's well worth it compared to how terrible coronavirus is. It says low battery, by the way.
Oh no.
Okay. So the answer is, la respuesta es, ¿qué reacciones hemos tenido después de la segunda vacuna? By the way, all those reactions means it's working, by the way. So feel good about it, even though it's a drag to have a sore arm. Las reacciones fueron que después de la segunda vacuna, son un señal que la vacuna está funcionando, que su cuerpo y su sistema inmunológico lo está reconociendo como un enemigo para batallar. Pero a veces se siente como una leve calentura, dolores de cuerpo, dolor de brazo, pero por un breve tiempo, tal media día, un día, algo así.
Okay, have they done trial studies on children?
That I know of, no. I don't think there have been trials on children.
Okay, and then here's one in Spanish. I heard that you need to have the vaccine at the center of health, like a hospital or a place like CDC. The governor has assigned pharmacies, but what is the risk of a reaction at a pharmacy?
Well, no, you don't have to have the shot only at a health center or a hospital. You can get it at a pharmacy, and I think that if there's someone who's extremely worried about, say, a bee sting allergy or something, even though I don't think that's a real serious concern, but if you're worried about that, I would go to the county health department sites because they have more medical personnel and paramedics and so forth. They are volunteering. However, the pharmacists can and do give vaccines, and I think the average person should have no worries about going to their pharmacy. La pregunta fue si se puede vacunar, si se debe de vacunar en un centro de salud o en un hospital. No es obligatorio. Tal vez una persona que tiene reacciones o alergias muy fuertes prefería hacerse aquí, allá, pero las farmacias son bien preparadas para darse la vacuna.
Okay, so actually, unless you have something to wrap it up, Dr. Poulos, I think that we have answered all of the questions.
Cool.
Except for the last one that somebody is asking if the Super Bowl crockpot recipe program will be rescheduled. And just so you guys know, it won't be Super Bowl because that's this weekend, but I promise you there will be a crockpot recipe, and I can still do the same one. We just have to call it something different. So,
sorry.
Dr.
Sorry
Dori,
to disappoint, and it wasn't Super Bowl crockpot.
I'm glad to see that you guys are still watching, even though it's not a craft, because this has been, we owe many thanks to Dr. Poulos for answering these very important questions and helping our community stay safe.
Thanks
And
a lot.
as you know,
Thanks for having me. This was fun.
and she is one of our hometown heroes, so thank you, Dr. Poulos, once again. And thank you again.
Thanks. Thank you. Thank you for having me. Bye-bye.
Bye, guys. Have a good night.